That gavel. All right. Welcome, everybody. Thank you so much for joining us for our November Public Safety and Community Health Committee meeting. First off, we'll have Chief Hall come up and give us the SPD report. Chief Hall, you are up, sir.
Good afternoon, everybody.
Just a second. Sorry,
Oh,
Chief.
1 second. Just standing by.
Technology.
There it is. There it is.
Good.
All right.
Okay.
Let's go.
Sorry about that.
Oh, you're good. Thank you.
As I explained the past couple of months, we're continuing to go through and modify this, try to make it more meaningful for council and more timely on different topics that we discuss over time. Some things we've taken out and we'll replace at a later time, maybe in 2 or 3 months. Some things we decided should be quarterly so that we're not wasting your time. One of the newer things we're looking at here is what we're doing downtown, and in a very broad sense, I just wanted to give a little bit of a overview of the scope of the problem downtown. So from a geographic sense, downtown precinct represents 2% of the city's geographic area. Within that 2%, is the second and division area that's represented by the 4 squares you see there. That represents 0.4% of the city. In that 0.4% of the city, it generates 15% of the drug-related calls throughout the entire city and 38% of the drug-related offenses listed in police reports and citations, meaning that the drug-related offenses are offenses that officers are engaging in or listing in their case reports or making arrests for. So almost 40% of the drug interactions in the city occur in that very small micro location. Yes, sir.
Just in the future, can we break down the difference between what's reported and the actual citations that have been given out?
Yes, sir. And just for clarification, you mean reported through 911?
Well, you said 43% of all drug-related calls, 68% offenses listed in reports and citations. So which percentage are no citations, but they're in reports, and which percentage actually receive citations?
Yes. I'm not...
Is that the next one?
Did we skip one?
No.
Yes, this is a same concept, only this is about trespassing calls. 40% of all trespassing calls for service, so those are the calls coming in. And 53% of all criminal trespass offenses, so those are the offenses that the officers are engaging in, occur in this micro location that represents 0.4% of the city. Whoa. You saw this last month. I just wanted to give a timeline of different things that have impacted public safety in Spokane. These are the major sort of sentinel events. Calls for service, once again, this is something that you've seen over time. This represents the calls for service year to date for the past 3 years. Calls for service, this generated some interest last month. We redid it a little bit to make it more meaningful for council. And what we did is over the previous 4 or 5 years, depending on the call type, we averaged it out. And the increases you see on the far right-hand side are the increase over the 5-year average. Once again, diving down into something that the council has expressed interest in, unlawful camping citations. This is for the year broken out by month, and you can see a rapid increase in unlawful camping citations over the past 3 months, August, September, and October.
Chief Hall, what do you attribute the jump in October to?
Incredible leadership.
There you go.
Actually, it's mostly due to the emphasis we placed on core and a re-emphasis of the downtown division through Captain Wool on addressing these crimes. Sit and lie citations. We discussed this last month. Not a popular citation with officers, as pedestrian interference is far easier to do for the officers in an operational sense.
On that note, pedestrian interference is a much wider geographical area as well, whereas sit and lie is very narrowly tailored to the viaducts, correct?
Yes, sir.
Yeah.
And here you can see the difference with pedestrian interference citations. Once again, you've seen this before. This is just crimes against persons year to date, and it shows increased activity. This includes calls for service as well as engagements by the officers, so self-initiated activity as well. We drilled down on assault. It's the most common crimes against person, and once again, you see the results here. This is primarily driven by simple assault or misdemeanor assault.
So Chief, then where is the domestic violence data captured?
We capture that separately. If that's something council would like to see, we can certainly provide that.
Okay.
We very much believe there's a difference in dynamic behind violence that occurs behind closed doors as opposed to violence that occurs in public spaces.
Thank you.
This is something that was asked for. We wanted to provide some information on missing persons, including missing murdered Indigenous women and peoples. So as you can see, for 2024, there are 32 open cases of missing people across the board, just missing people. Of that 32, 0 in 2024 are Indigenous women or persons. 6 are juvenile. As we dove into those 6, we can say with relative certainty those are chronic runaway juveniles and juveniles who are on foster care. We just highlighted the information on the right about individual cases. That's all on a public website that's on our website that can be viewed by anybody who's looking at the sort of generic details of what happened behind that case and where that case is right now. Shooting calls? Yes, sir.
Sorry, real quick on the last one. Just specific to Indigenous missing, murdered, do we have any separate stats or any separate sort of updates on efforts on that side of things?
Just what you see up there. We had 1 in 2023, 1 in 2019
Okay.
for adults. The shooting calls speak for themselves. And this is shooting calls with injury, or what we call skin piercing shooting calls, where somebody was actually injured and suffered a gunshot wound. These are shooting calls that we've confirmed actually occurred, but there was no injury or nobody was shot.
Chief, since I don't have my other glasses, how many, are you able to tell me how many were drive-by shootings? Or it's just all wrapped up into that one total?
Can that be
This
reported
is-
separately?
This is all wrapped up, but we can
Okay.
certainly do a separate report on
that would
drive-bys.
be, I think that'd be a little interesting as to what that will look like in Spokane. Thank
I
you.
agree. This is all arrests through January and October, so year to date. As you can see, the officers have been busy, increased activity, both for calls for service as well as self-initiated activity. I would suspect, and we will dig deeper into this for more detail, that this represents a greater drive towards self-initiated activity, or that the officers are producing these results not through calls for service, but of their own initiative. We wanted to highlight some of the top offenses, and this is where we get some of that anecdotal data about what the officers are doing. Trespassing, simple assault, drug narcotic violations, those are the top categories, and those also represent categories that the officers take on themselves to address without a call for service.
Can I ask a question really quick?
Go ahead.
Councilmember Navarrete online. Go
Thank
ahead.
you, sorry. Chief, going back to the slide of shootings, is there data on if the guns were registered to the individuals that, made the crime?
Where
Does that make
a gun
sense?
was recovered in a shooting, we can certainly provide that information.
I love that, thank you.
Last month, I promised a little bit greater detail in traffic collisions and where they are occurring within the city limits. This is going back to 2017, the top 10 locations of collisions that occurred with injury. Just let you take a look at that.
Is this just raw numbers of total incidents?
These are raw numbers. We were talking about doing a crime harm index or indexing the different injuries, but we haven't done that yet. It's certainly something we could do if you're interested.
Guess I would quickly say to the people of District 1, maybe pay attention when you're driving a little bit more. That looks like a lot of us up there.
And the most common contributing factor is speed. This is just within the past year. And there's a lot of overlap from the previous slide that had several years to this, it just covers 1 year. Moving into the staffing update, this hasn't changed a great deal over the past month. And as I had previously informed council, we're looking forward to having our officers that are in field training, coming out of field training over the next 5 months, and that's, as it stands now, 14. And once again, a highlight, 65% of our commissioned staff are assigned to patrol. Just outline some of the commissioned assignments. And that's all I have for you. If you have any questions or any comments on how we're trying to reformat this to better fit your needs.
Yeah.
Councilmember Regal.
Thank you. I've got a couple. So on the calls for service, I remember in one of your first presentations, you had said that when there's a discrepancy like that or such a massive jump, it might be like a category error. I see on our calls for service for this year, can we put that back up? Is it possible to get the calls for service back up? The calls for service for this year, again, are pretty high. Were we able to dig into that and figure out if it was a category error, or is it just that calls for service are up significantly?
I have to look at that because I think there's an increase in crime check calls.
Which would be included in the calls for service?
Yes.
Okay. So just so we can see, sorry.
So while she's pulling it up, Chief, when will you have or be able to present the month data on the core, our pilot project downtown, and what that data will be telling us, and then how you'll pivot? When will you be able to share that with us?
I suspect we'll be able to share that next month,
Okay.
once the initiative has been completed and we've been able to collate the data and analyze it.
Okay, thank you.
I think we're getting close. The calls for service.
Not shooting.
Yeah, it was well before this. before this. Yeah, right there. There we go. So calls for service, it was an increase in 30,000 from 22 to 23, and then on track this year, looks like we'll even surpass those numbers. Or are those projected through the end of the year, or is that current calls?
These are current calls. This isn't a projection. And it looks actually pretty static to last year. I have no idea what happened in 2022, but I would suspect 30, or actually that's about a 25% increase. That's a process issue that we can certainly look at.
Well, and that's the question, is because if those are current calls for service, then we're averaging 20,000 calls a month. And so I would imagine you could add another 40 there. And so we'd be at 250 at the end of this year, if that's just current data.
Yes, sir.
So that, again, to me, that looks like a steady climb. But I would also be curious to know on like all the crime check calls and everything like that that comes in, how many of those calls receive a response from an officer or from some sort of technician of some kind, whatever it is? How many of those calls that come in get a response?
To crime check?
Crime check included, because again, what I hear about crime check a lot of times is thank you, we've heard you, and then that's like the end of it. And so that would be good information to know. My last question is on the 0.4% of the city there, which is again one of your first slides. At what point do we maybe start pursuing some nuisance laws that we have? Because if it's 68% of the citations and 0.4%, I don't know that we can deny that it's a nuisance area at a certain point.
Yeah, as far as, if you're talking about nuisance abatement laws against businesses, I'll follow the lead of the city attorney on that.
Okay, so we need to, okay.
Yeah, just as far as the focus downtown goes, I guess two questions. One is, to date, how many arrests have actually been made versus citations or just moving folks along? And then related, have we seen any changes in our ability to respond to issues outside of downtown? Has any of that changed in your view?
Yeah. In response to your first question, we were trying to strip out that data this month. We struggled to do that. As I said before, police data is dirty or noisy data, and it takes a lot of cleaning. Hopefully I can have that for you next month. In response to the second part of your question, which I just forgot.
What was the second part of my question?
Arrests. Bookings and citations.
Well, yeah, the arrests, total arrests versus the bookings, and then how it affects the outside areas, the neighborhoods outside of the downtown.
So stripping out what's booked and what's strictly a citation, we have to do that almost by hand because the way our system is, that they're all arrests. So we have to go through and clean that out. There has been zero impact on the rest of the city because we're still utilizing staff on overtime, and we're not pulling staff out of other parts of the city.
Okay, and then one more?
Yeah, of course.
Just curious, not entirely related to your presentation, but important. The COPS program is an important partnership, and the budget came out. It's not funded, at least as of right now. Hoping to change that. But I'm just trying to understand from the PD's perspective, how will you, if in fact it's not funded, pick up the slack of the latent fingerprinting, some of those additional patrols in our parks and things like that, and then also just the uses of the facilities that COPS has just for our officers to work and whatnot. I'm just kind of curious if that's been discussed.
We have had those discussions and what that looks like if the COPS program is not funded. Everything from enveloping those volunteers into the Spokane Police Department's volunteer program, and then sort of decentralizing those tasks out again from the SPD's volunteer program. As far as the facilities, I'm not informed, or I don't have the information enough on the leases of those buildings or who actually owns all of those buildings and who's paying or funding for those leases to be able to speak to that. I can certainly come back to you on that next month.
I guess the only thing I would say in response to that is, obviously volunteers can do what they want, but I don't get the sense that COPS is just going to disappear. So I think it's pretty bad faith if we're going to try to take away their volunteers and then not even support or fund the operation of the program. So I would just say I don't think that's the right move to siphon off volunteers and not fund the program.
Right, and my comment was if they're not funded, we would certainly try and take on their volunteers.
Well, if they go away, but it
If
might
they go
stay
away.
even if they're not funded.
Great. Any other questions? Well, thank you so much. Really appreciate all the data, Chief Hall, and you being so respondent to a lot of our questions and needs. Thank you so much.
Absolutely. Thank you.
All right. Next up, we'll have Chief Oberg come down for the Spokane Fire Department update.
Afternoon. All right. Start out with our staffing report. No changes from last month. Still holding our relief pool at 17, and just the planning part of a 2025 academy is underway of what that would look like and dates, and starting to work with civil service of what that could possibly look like. CARES expansion is moving. Our first new employee of the CARES expansion starts tomorrow, and they're actually interviewing, as of today, they're interviewing for the additional positions still. So looking forward to getting that new person starting and hopefully making some additional job offers as those interviews proceed. Overtime status, 7% lower than we were same time this year. Obviously, that is still over our 2024 overtime budget at 129%. So that's a nexus of 45% difference from where we should be at the budget year to where our budget is. And then just the visual representation of that, with the top one just being literally just the overtime budget and the bottom one being the hours. So I think I mentioned this last month, that while the dollars are over, when you look at our overtime hours, it is under to where we were last year. So just what wasn't necessarily taken into consideration for the overtime budget was the 14.3% increase when debit days went away, as well as the contractual increases. Response metrics, similar to what Chief Hall had mentioned, that they're trying to work on their data to make it useful to you. We are as well. I would say this slide is probably less than useful, other than just a very high-level look, but we're working with our IT team and our data. Our data is also what I would say noisy data, so sometimes really getting to something that is useful to you guys to see month to month. I'd like to show this more in trends for you guys to see, and if there's any request on how you would like to visualize that, we're absolutely open to that as well. But really what this is telling us, no significant increases. We run about 5,000 calls for service a month. And what we're looking on, we don't necessarily make it on scene on all of those. So there is a significant of how much time we actually are committed to an incident versus how many incidents that we are dispatched on. Overdose data is, there's really no surprises of what we're seeing here. Last month there was a little bit of a blip downward, but as far as the trends, we're not seeing a significant trend one way or the other. The number of patients that we're transporting to the hospital as a result of an overdose has been in that 40 to 45 really throughout the summer. That hasn't changed significantly. The Narcan, the patients treated with Narcan, I'll continue to say this every month. Remember, that is really a one-dimensional view that I caution us on making too many determinations of what that means. That is our application of Narcan only, not Citizens, not PD, no one else. So, and it's not necessarily how many doses we delivered either. So I caution us on making any decisions based on that number.
Councilor Beagle?
Yeah, Chief, sorry, before you move on, can we go back to that? So I think I heard you say that you don't see a significant trend one way or the other. Is that what you said?
Well, I don't see a significant change month to month. Obviously, you can see the trend line is
Right,
going
okay,
up. But
okay.
but as far as from last month to this month, we're not seeing significant jumps month to month.
But year
But
over
the trend is still going up, yes.
Okay.
This is the heat map of where we're seeing those. Right now, this is directly out of one of our records management programs, so it doesn't get as granular. We are working with GIS to be able to get granular even down to a quarter mile blocks so that we can kind of see where that heat map looks. But this particular data program does not allow us to get that granular. Nurse navigation. So nurse navigation is, again, this is when somebody calls 911, if their initial triage seems appropriate to go get transferred to a nurse to either deal with, have virtual care, being sent to urgent care or self-care, they'll go through nurse navigation. What we're seeing on here is about an average of 40 calls per month that are diverted away from a response. We still want to see that number go higher. We're still meeting monthly with the nurse navigation team and SHREC to see where are areas that we can continue to see that number increase. I'm happy that there's 40, but I think there's still room for others. The other two parts in here, you'll see the bullet points to the lower right. Those are just some of the calls for service that have been successfully transitioned. So as you read, everything from their BiPAP machine didn't work, and as the nurse walked them through, they just realized it was unplugged. So 6 months ago, that would have been a response of a fire truck and an ambulance rather than just a nurse call walking them through that. So there are some really successful diversions from fire truck or ambulance responses. And then it's kind of hard to see, I know from this one, but that the circle graph below, they ask the question, so nurse navigation follows up with everybody that was diverted. And one of the questions they ask is, why did you call 911 in the first place? And the bulk 28% is, I thought it was an emergency, but there's a pretty good chunk there that they just didn't know where else to call. And so I do think that there's a continued avenue for us to look at how do we educate even before that phone call was made? How do we focus our community risk efforts on that? Yes, sir.
Just wondering, based on call volume, what percentage have you been able to sort of divert to these alternative options that's not using up the same level of resources?
I mean, it's only 40 a month, so we're not even into 1%.
Okay,
Yeah.
so it's that, okay.
Yeah, we definitely, I mean, I'm going to take every one away as a win, but if we look at what other communities our size are seeing with nurse navigation, we should get up into about 10 to 15, I think, is probably the most that we can realistically reach for. So we've got some room for growth there.
Will that require hiring additional staff to play that role then?
No.
Okay.
No, nurse navigation is proprietary through AMR, so this is a part of the AMR contract, and this was paid for with AMR rate raises last year.
Yeah, I'm really excited for this program. I'm hoping that we can find a way to help it get some more traction. I've spoken to a number of individual firefighters about what they thought about the program, and it seems as if most everybody is pretty high on this, and I think it is going to be something that helps save us a lot of time and a lot of money, a lot of wear and tear, while getting people the service that they need faster. I would continue to be interested in, as you're doing those sort of exit surveys, why did you call? And maybe there's something more we can do there on that education side, but really excited for the future of the nurse navigation. So
Yeah, I definitely, like I said, I think there's some community risk and public education opportunities. I honestly don't know exactly what those look like now. I think we need to dig into that data a little bit more. One of the next steps that we're looking at doing, and again, this isn't ideal, but we can, other communities do field referrals. So this is, even if an ambulance or a fire truck went, when they get there, if they further determine, no, this really could be nurse navigation, they can then refer that. Now, that's already cost us a response. We're already there, so we would really like to catch them before we're dispatched. But I think there's some opportunity. We need to make sure that we launch that appropriately and that we give our crews the appropriate training before we do that. But that is an opportunity that we're looking at.
last comment on this is that if we figured out a good way to say, hey, here's the process to go through, and we wanted to do some sort of educational piece that went out to all the households in the city of Spokane, I would support that to get it out, because again, I think it's something that initial investment early would save us money in the long run.
Agree.
So if we could come up with a good program for that, I think that would be really helpful.
Agree.
Yep.
Councilmember Dillon? So Chief, you said the nurse navigation is part of the AMR contract. So when does that contract renew?
So-
And we're looking at an increase in cost to provide that service.
When does the AMR, so the AMR contract as a whole is out for RFP. We're getting ready to go out for RFP soon because it expires, I believe, next June or July. So we're working on that RFP right now. The nurse navigation is part of our contract. So when it came on board when it first came in discussion, I believe, in late 22 or 23, it was an amendment to the current contract, and there was a rate raise, and nurse navigation is paid through that rate raise. So there is not a check that we as the city write for nurse navigation. It's paid off of their rates.
And that particular program will be part of the new RFP?
Yeah, yes, it would be. We obviously, nurse navigation is proprietary to GMR, but, I mean, we're looking at, we'd want something like this written into the RFP for anybody that were to bid on the transport contract.
Thank you.
Just some ongoing initiatives. Last month, we had a fire department from Mexico that was in town to pick up a brush truck that they bought from a fire department in Canada. We were able to give them some spot to look at the rig, make sure that it was road ready to make it all the way down to Mexico, and we were also able to get some surplus fire equipment donated to them that for us would not even be on a reserve truck, and they were very grateful for that. So that was great to see. The HVAC replacement funded through ARPA dollars tentatively is set to start in February. So thank you guys very much for that support on that. Also, there was a mold concern that came up as part of some Station 1 concerns. That testing has come back. There is nothing actionable on the mold testing that came out of that concern. As we are continuing to shuffle through not only the new heavies that we have, but new staff vehicles and get some of the very old fleet off the books. The new STARS car is scheduled to go out to Raycom to get completely outfitted, so we are trying to make sure that we hurry that through and hopefully have that in their hands before winter weather hits. I think that's it for ongoings. I think we've already mentioned this, but our Fire Marshal, Chief Dahl, was recognized as the Washington State Fire Marshal of the Year. We're really proud of Chief Dahl and the work he does there. I think a really neat part of the recognition is he was nominated by his own internal team. And the Washington State Fire Marshals said they had never had a nomination from an internal team for a fire marshal. So we're really proud of him. And then in your packet, we had several kudos, so I didn't put them all up here, but they're in your packet.
Congratulations to Chief Dahl. That's wonderful. Yeah, go ahead.
Yeah, so you mentioned the relief pool right now is at 17. What has that been generally for the last couple months?
It's been, I think when I started doing these reports, I believe we might have been at 19 or 20. So it hasn't dropped significantly in the last few months. I will say 17 is the highest that it's been since I have worked at Spokane Fire Department.
But it's been that way for a little while, at least.
Yeah.
So I guess my question, just again, budget's out, and it shows very low amount of overtime for fire relative to what we're spending this year. And I keep hearing that it's based on the fact that we're going to have a relief pool of 25, which to me doesn't seem all that substantially larger than 17, certainly not to save $4 to $5 million. So I'm just trying to understand kind of what are the changes, internally. The nurse line's great, but 40, that's really not even statistically significant. So what are we doing to ensure that we're not going to be spending $7-8 million like we are right now on overtime?
So, I'm not sure where the number of a relief pool of 25 has come from. That is not a number that I would necessarily recommend. I think we have some break-even analysis done that shows that really per battalion, so per platoon, that number really should be 10 to 15. So, I mean, I think somewhere around 40. And again, that number's never going to stay exactly the same because we're not going to do, just because we drop 3 or 4 people on retirement, we're not going to do an academy of 4. So it's got to be a fluctuating number. But we've got some break-even analysis that show us where does it make sense to hire an FTE versus not hire an FTE and fill it with overtime. Additionally, one of the things that I think that we have underanalyzed in the past is outside of operational overtime. So contractually, we have this many units in service and this many people that need to staff those units. There is other overtime that we have to pay for, some of it contractually, some of it just based on best practices, whether it's training, whether it's the add to pays. Those have been underanalyzed, in my opinion, in our overtime budget. So having those flushed out and discuss that along with that health, I mean, clearly the relief pool is the biggest part of that equation, but it does not solve everything. So I don't know if I rambled enough to not answer your question.
Yeah,
or...
I don't think I quite got an answer. So essentially, right now, my understanding is we're spending about $8 million in overtime at this point. Next year, I think we're budgeted somewhere in the $3 to $4 million
Yes.
range. Well, 2 years in a row, we have not been anywhere close to that. So what is changing prior to Jan 1 that's going to allow us to only spend $3 to $4 million in overtime and not exceed that? And this isn't just kind of kicking the can and we're right back in this situation a year from now.
Nothing by Jan 1, but a 2025 academy to get those numbers up much closer to where we do know that a healthy relief pool should be. That's going to be a significant one. And then also just to honestly daylight the other discussions, the add to pays and the training requirements that historically have been covered under overtime, and it's just kind of been absorbed, if you will, rather than really living in its own line item, that this is how much we need for quarterly trainings that is overtime driven, this is how much we need for add to pays that also include the contractual increases in pay. And just, again, in my perspective, and that may not be entirely fair, I wasn't a part of those, but I think those have been underanalyzed when it comes to that. So looking at the number that we have going into 2025, it's a healthier number than we've had in a while. That coupled with getting that next recruit academy, which it's halfway through the year before we get that. So fair assessment that Jan 1 does not necessarily put us healthy from day one, but I do believe we're on the right path.
Okay.
Councilor Klitzky.
Last question.
Is an add to pay like an additional qualification?
It is. So add to pays are everything from our technical teams, so the water team, the tech team, the hazmat team, depending on what level of certification they have, their base pay, and then their add to pay if they're on that team. But we have additional add to pays for, again, several of the, outside of being a stock model firefighter, if you will, that have add to pays. And those have not necessarily always been included in a reasonable way in budget projections and budget growths.
Just quick, Chief, have you noticed a change in behavior or calls with the core pilot program downtown? Not necessarily directly for our impact. So obviously we're there supporting PD. I think that we have had some really great conversations between our BRU and our teams and what PD is doing that have highlighted for both of us how there's some areas that maybe we weren't partnering, or some even just introductions that we didn't know that these two teams needed to know, some of the NGOs and things like that out there. But as far as a significant, our BRU or our downtown crews are seeing a huge difference, no. But I don't think that is, that's not a negative indictment of what the program is doing. It's just really, for what we see, it's such a supportive role. The BRU, these are still treatment-resistant individuals that they see, and they're treatment-resistant individuals. That's where we come into play. The core program hasn't necessarily changed that. Thank you.
Yeah, thank you so much. All right. Dawn Kinder, inclement weather reports.
Hello, Council President and council members. Thank you for having me in today on kind of quick notice. We just wanted to give you kind of the final update on the inclement weather plan for 2025. This does include November and December of 2024 and then the full calendar year of 2025. So it's a 14-month plan. The first slide is just a quick overview of the timeline.
Advance.
Oh, I was staring at Ginny like she was going to do that. There we go. And you've seen this, part of this prior when Ariel was here, but as a recap, we did post a request for information for 2 weeks in late September to glean feedback on our proposal to do a per night cost at existing shelter or 24/7 operations to maximize funding and resources. The RFI yielded several responses, which we then presented to council at, I believe, a study session on September 26th, as well as to various community groups. We held a feedback session on October 2nd with the respondents as well as the county, as they had facilitated an RFI at the exact same time. Based on their feedback, we incorporated some changes and released an RFP on October 7th that closed 2 weeks later on October 18th. We shared a matrix of funding options with our CHHS RFP committee on the 23rd, and then they made recommendations that we have taken action on, and they will be presented to the board at this week's board meeting. And then those contracts are underway with the effective start date of November 1, which has been sticking to our original timeline.
Go ahead.
Yeah, I guess I'm just trying to understand. I mean, how are we signing contracts when council hasn't even weighed in on the plan yet? I mean, 800,000 out of 1590, we've got to approve that.
So what we're actually doing the original plan was based on the $250,000 cap. That would have allowed for minor contracts for agencies, so we are moving forward with those minor contracts. Every amendment will come back in front of council, so I've got that later on a slide. The other issue with this is that agencies will not be spending down in a predictable format, and they will spend down at different paces given the number of beds they have, their price per bed, how many beds are utilized. So giving them a starting point and then adding funds as they spend down will allow us to not over-invest at a particular location and then bring each of those amendments in front of council for review. So our plan, just as a summary, which we just kind of talked through, was to utilize existing programs to reduce costs. We know standing up brand new warming center style locations is incredibly expensive because we're paying for entire new teams of people and locations. So we put out the RFI that had this information in it. You've all seen that before, but certainly happy to ask questions about it, just what we prioritized, and the cap we put on the per bed rate. Agencies, the eligible expenses include the agency's administration, operation, and supplies. We're applying the Washington State Department of Commerce SDG guidelines to these funds, which are very consistent with other shelter-based operation state guidelines for what are eligible expenses, what are not eligible expenses, et cetera. So the outcomes, the RFI, as you all saw in September, resulted with 4 providers submitting for 357 beds. The RFP looked pretty different. We still had 4 providers, but it was one different provider. So Family Promise responded only to the request for information, and Volunteers of America responded only to the request for proposal. So still 4 partners, but one swapped. So those main differences are listed there at the bottom. The main difference in the bed count is that Salvation Army had proposed 175 beds as warming at the track location, which obviously is no longer open, so that was not considered in part of the RFP. So this is the final slate that went in front of the committee. On the left is the budget, that was presented to the committee with the $250,000 cap on annual inclement weather funding. That would have yielded us 133 beds for 32 nights throughout the year. We did, just as a point of note, negotiate with Salvation Army on their per bed rate and with Revive on their startup costs and reduced both of those. Revive had originally asked for $15,000 in startup costs. We got them down to $7,000, and we'll be purposing some of our equipment at track for their warming center or inclement weather bed operations. And then we negotiated a lower bed rate with Salvation Army at their family location. They had initially asked for, I believe it was $70 per bed at the family site. We worked that down to $34 per bed, which was a substantial cost savings. And then on the right-hand side is the inclement weather budget plus the 1590 funds. That gets us to 133 beds again, but at an increased rate of 143 nights for the 14-month contract session. And then just my last slide here, just kind of a summary. We did, as you all have seen in your roundtable discussions, we know that there's kind of a prediction of the region needing about 141 days of activation based on the current SMC. So this total budget gets us just past that to 143 nights. There's a summary on the RFP session there, and then the unallocated 1590 funds that were identified as a one-year budget solution. As you've seen in the mayor's budget, there's a proposal for an increase in the 2026 budget to make sure that we can meet this gap in the future years. And then those contract amendments, as I mentioned to Councilmember Cathcart's question, will come back in front of council and have the current minor contracts have an active start date of November 1. And then we will be notifying agencies, but their point of contact at each of those locations by 12:30 p.m. if there's a need to surge that evening for those inclement weather beds.
Go ahead, Councilmember Cathcart.
Yeah. So, we've got some code provisions, one of which is, you can't lose beds, which I don't think we're following. But I wonder, though, why, we seem to be following this other one to a T, which we don't do otherwise. And, I know the county participated in the RFI, but they're going a completely different direction, and frankly, a more fiscally responsible one, which is, focusing only on days where the weather is extremely out of the ordinary, rather than just simply extremes. We know we have a terrible winter. We know we're going to have a terrible summer. So when the days strike that they're significantly out of the ordinary, which gets you down to around 30 days, which is a substantial less amount of money, and I believe that's the direction that they're going to be pursuing. And so I just wonder, have we thought about that? Because obviously we are in a budget crunch and don't have a lot of extra dollars, and 1590 really, in my mind, should be used for capital, for housing, or, if we can come up with a grand transformative plan, behavioral health. But to swipe it away into a black hole, I just don't think makes a ton of sense. And so that's a challenge, I think. The other is, if we're going to continue down this path, and I argued this 2 years ago when we passed this, we should actually do it in a scientific way, which is temperature is not, it just doesn't make sense, right? You got to look at humidity and wind chill and these other things if you're really going to do it on a scientific basis of when it's not habitable to be outside and in those situations. And so I just wonder, has there been any look at either looking at the specific code for amendments that might make this more fiscally responsible for this community, looking at more partnerships to do it on a more volunteer type basis, because it just seems to me like there should be a number of partners, from religious institutions to schools to community centers, and not just city-funded community centers, to do this work. And so I'm just wondering, what does that look like?
A couple things, because you covered a lot of ground.
Yes.
To my knowledge, the county is not funding any inclement weather beds, but I do acknowledge that they have a different activation criteria that they've put out. And we've had conversations with the county. We were very excited that they did the RFI with us, and then we're disappointed that they were not moving forward with funding those, but certainly continuing to work with their staff on how we can activate those proposals, because they had some good proposals come in. On the 1590, we agree this is a one-time use solution. This did come out of the housing services category following that split. Excuse me, and this was after fully funding every request we received. So we fully funded every affordable housing services request we got in that open RFP. These were remaining funds. So it's, perhaps not best use, but certainly an ideal way to close the gap this winter as we try and just save lives. And the Alliance was very helpful in engaging in conversation with us to make sure that we understood their needs and they understood this is a one-time solution. In terms of changes to the code, I think right now we're just trying to follow the code as closely as possible, knowing there's some places where financially it's impossible, and the bed count reduction is a good example of that. If there's openness to changing, the SMC, we're certainly happy to talk with council about that as you all decide what might make most sense.
Councilor Zappone.
Yeah, and I just wanted to address some of those issues you brought up are exactly what we talked about at the last roundtable conversation. I don't think that's really, the administration is putting forward a proposal based on our current code. And to your point, I think there are lots of concerns about, the financial responsibility of that, what's the right medical decisions. And that's exactly the conversation that we had at the roundtable. And I believe that Nicolette circulated all of the data that we had for that around the weather. From that conversation, people talked about wanting to address the weather index or the temperature index rather than just a blank temperature. So that is being addressed and being talked about. The number of days, that information came out of their research of the 141 days that is historically at 32-degree index. I'm not sure. No, we've reached out to the health district, and that was their recommendation, is to keep it at 32, was from our health officials. So I'm not sure what the county or where that information is coming from the county doing only 30 days. That's not information that has been shared with us through our roundtables when we've been reaching out to our partners to try to understand theirs too. So just update, that is a part of the conversation that will be coming back to committee after the roundtables.
Go ahead.
Yeah, on that, I mean, I think, I'm sure SRHD recommended that because they're not funding it. So it's easy to make a recommendation when you're not the funder. But I guess my other question is, what are we doing, and this has been a real frustration of mine, to emphasize the folks who are housed but don't have a place to go when the weather does get to those extremes? And, be it families, be it, older single individuals with dogs, they don't want to leave, cats, animals, et cetera. That to me is a huge, huge problem. They don't feel safe to leave. They don't feel like there's a place they can go to take the animal or to go and be safe. And so I'm just trying to understand, what is the emphasis here? Because all the locations that we've identified are clearly for, the folks who are experiencing homelessness and would be wildly inappropriate for, a 60-year-old woman and her dog to go and get warm. So I guess, what is the plan for those folks?
Well, one quick note, I would just like to point out, as Councilmember Zappone pointed out, that the research Nicolette did was very helpful for us in this process. So that feedback and the data she pulled was very useful. And to your other question, Councilmember, I know Sarah Nuss has been working on plans with community centers to address the housed population. I'm sure she'd happy to come give an update. That's really not the focus of this inclement weather SMC, so I can't speak to that today.
Thank you. Good question.
I will just comment that the data on the temperature, we specifically asked Dr. Velasquez as the health officer for the county. And so that's why that was based on that, not just the county, but the health officer is where that came from.
Yeah, his report was very clear.
Thank you. Any other questions for Dawn? All right.
Thank you.
Appreciate it, Dawn. Thank you so much. All right. Adam McDaniel, ordinance updating the penalties for illegal dumping.
Yeah, so last session, the state legislature adopted House Bill 2207, which adjusted some of the penalties for littering. What this ordinance does is basically repeal our current litter ordinance and then reference the state law that was adopted. The penalties that were updated, the lowest level, the class 3, still remains a civil infraction 3, $50 fine. Anything over 1 cubic foot to less than 10 cubic yards is a misdemeanor where it was formerly a class 1 civil infraction under our code. And then anything, the big egregious like construction level waste over 10 cubic yards is now a gross misdemeanor. I think there is maybe a desire from Councilmember Dillon to kind of revisit what our junk vehicle abatement ordinance looks like. So if we want to kind of do that concurrently with this, we can definitely do that as well.
Yeah, I guess I'm just wondering, I mean, I think this is great. It makes total sense to me, but I think we're talking about it like it's going to be a big game changer, but I'm not really understanding how we would enforce this, any more than we've been enforcing the previous code. And so I don't know if that's been a discussion point, that this will really be an emphasis, or how that's going to work out.
Yeah, so the legislative intent was, of course, as a deterrent, because there is legal dumping happening all across the state. I think the question of enforcement is obviously a code enforcement question and a PD question as well. I think Maggie will talk about a little bit some of the impacts that we're seeing in code enforcement, and she'll share the dashboard here in just a second.
Yeah, no, I know it's very impactful, so that's why I support it. I just don't know how we're going to enforce it.
Yeah, I think part of the help too is potentially the NROs coming back. I think the NROs are a great source for helping to identify those areas where there's significant unlawful dumping taking place.
Great. Any questions for Adam? Well, thank you. Yeah, we'll follow up. I know Councilmember Cathcart expressed interest in the junk vehicle portion of that too, so we'll have some follow-up on that. All right. May Yates, Code Enforcement Dashboard. We got Luis too. Thanks so much for being here.
Thank you, Council President and Council members. Thanks for having us. Ginny, I don't know if you can pull up our website, /metrics. We just wanted to make sure Council was aware of a new dashboard that's available on our website that captures the work of Luis's team with all of the various waste collection and disposal across the city. We have broken it out in terms of the number of calls for service that have been completed or in process, as well as the pounds of garbage that have been collected from private properties, from our HOT team, and also from, what am I forgetting? A third team. And other abatements. So you can see it's compared to 23 and 24 year to date, and we just wanted to, sorry? What's the website? /metrics, our city website. Yeah.
Is that cityofspokane.com?
Yeah. My Spokane, there you go. There you go, it's the first one. So here it is, and you can click on either one and interact with the data. And then Luis is here if you have any specific questions. But a huge thanks to our code enforcement team and also the PMO, which helped really construct this and launch it. And really, it's the first step in capturing some key performance metrics and helping us track our performance and be outcomes oriented. Luis, anything to add?
Yeah, so I think the overarching intent of actually having an outward-facing view of this is to really show the public that we are running all day, every day type thing, instead of, sometimes a case will take a little bit longer than needed, and hey, the city isn't doing anything. I think the statistics speak for themselves that we've consistently been trying to respond to as many locations as possible throughout the entire program, and sometimes a private property abatement might take a little bit longer than, say, a encampment abatement would. Same deal with unlawful dumping. Those are all challenges in itself that, to your point, Councilman Cathcart, we want to be able to investigate that. If we can identify a responsible party, we need to be having people held responsible for it. So there's an inspection component ahead of that, but this is going to show that work that the labor teams do all day, every day.
Yeah, just to that end, I mean, it'd be great if we could include, number of citations, et cetera, per month to see that enforcement.
Yeah, absolutely. Officer action. So so this was supposed to highlight the labor side. The code officer actions is something that we can respond to. I would say that unless it's a successful identification of a responsible party, it would be that the labor team would just go and abate to minimize the adverse impacts to adjacent property, because the time that it stays out on the right of way acts as an attractive nuisance. So our goal is to try to hit it as fast as possible instead of trying to leave it in there for investigation purposes. But if it's something that's a clear identification, we would pursue it. So I would say that the code enforcement actions are not going to be reflected in the amount of work that's being done as far as abatements for unlawful dumping.
Yeah, I think this is great for a lot of reasons. I think it's good for the people to see the amount of work that you and your team are doing. I mean, the total pounds of trash that are picked up here, right? When you're seeing 3 million almost on that is pretty incredible. You mentioned something about inspections. Can you talk a little bit more about that real quick?
Yeah, that's in response to the unlawful dumping. So the case process is that when we identify or get a complaint of an unlawful dump, we will respond in a inspection prior to the abatement. The idea there is to try to identify a responsible party. If we can, talk to neighbors, see if there's anything identifiable in the debris, then that may elongate it, but we'll go ahead and we'll reach out to the responsible party. So that's kind of the first step. Most of the time, it's not. It's, loaded tires, some household waste that doesn't have anything identifiable. We'll then put it on a work plan for our labor team that is getting that list daily. So there may be a couple of days in arrears that they're running, but it is a perpetual workload that will have a team going to all the illegal dump sites. And this is citywide, so they're not trying to prioritize region in this case. They're trying just to run all day, every day with the city, within the city, trying to get to all those cases.
And then this is actually for the last ordinance, because I was thinking about the infractions on that and the fine being only $50, but I'll ask that at a different time.
Oh, is there more to the presentation?
No, just wanted to highlight, so here you can see the site status, 23 compared to, or 24 compared to 23, and you'll see that our code enforcement team has actually responded to more sites this year than last, and I believe the pounds of garbage collected this year compared to last is also higher. So a testament to Luis's team, who have an incredibly small staff doing impressive work across the city.
I guess the last thing I would add, because you were talking about cost, would be that if we have a private property abatement, a lot of times we work with that property owner, so the cost may be applied to that property. So everybody has a responsibility to protect their property. So if they're, it's an unlawful dump or a hoarding situation, we would be working with that property owner for an abatement authorization agreement from them. Then we'd go and abate, alleviate the violation, but the cost would be placed. So hopefully there is some sort of recoup of cost there, but that's the way we would do it, is mostly on private property.
Yeah, related but unrelated, I'm just trying to understand, where are we at right now with the hauling RV and abandoned vehicles? Are we still out of funding? Have we found new funding for that? Are we still on pause?
Yeah. So no, we're still trying to respond to all nuisance vehicles. This is really a big kudos to the Spokane Police Department Abandoned Auto Unit that's really working these types of cases. Even without the end game being a dismantling of a vehicle, we still want to make sure that the rules of the road are being enforced. So parking services along with AAU are still visiting the sites. Their level of effectiveness obviously is going to be impacted if we can't have a resolution to a case. But that's we are responding to all the complaints that we get.
And just for clarity, when we had spoken last about this, you said you had about a 60 vehicle backlog. Has that increased?
I think it was 30, and it was
30.
yeah,
You're correct, 30.
30, and each one of those, and that's been identified through the AAU. So that's specific to them. So yeah, that's where we're at right now. Usually those are about, if it's going to get dismantled, about $2,000 a vehicle.
Okay, so we still need about 100,000 probably to get through the year.
Yeah, that would be something we'd certainly utilize.
Great. Council President.
So, Luis, on the abandoned vehicles, so the cost is to the city up front to have them towed and dismantled?
So that's
Where's the cost?
Yeah, that's a great question. So, so the way the process goes is now when you register non-passenger vehicles, your registration includes this disposal fee that goes onto it. So the state is collecting funds, but that's a reimbursement program. So if a tow company, a tow operator responds, takes the vehicle, has to dismantle it, they obviously are incurring costs because there's not a lot of recyclables in some of these non-passenger vehicles. So to kind of offset that, this was really a statewide thing. It's really a national thing, but Washington tried to offset those costs by saying, hey, you can apply for reimbursement with this pot of money. My understanding is that there's a substantial backlog in reviewing those reimbursements, so they have ceased that program right now, but that's something that we're still tracking.
Just to add, those it is our understanding that the reimbursements have been suspended right now, and we're working with counterparts at the state to adjust what's going on and how we can rectify it.
Thank you. All right. Any other questions? All right. Thank you both so much. Melissa Morrison, you're going to come down for the opioid response fund, and Ariel as well. So we'll take this in tandem.
Good afternoon, Council President, Council members. Thank you. So there are currently two amendments before you. One is to increase the contract amount by $1,876,233 for the housing navigation contract. This would allow more funding for EHF to identify scattered site facilities within the city of Spokane. The other piece of that is providing an additional $124,350 to Revive for their street outreach to identify folks that are currently or at risk of being exposed to opioid use disorder. And I think that that in particular fits nicely in the context of the scattered site, trying to identify scattered sites that specifically will focus on subpopulations and their needs, and that certainly is one of the one of the biggest that we have right now in the city. So any particular questions on that? Yeah.
Yeah, the 1.8, where is that coming from?
That's coming from the ARPA, and there were two specific designated uses for that. One would be to relocate services from the downtown core, or specifically for scattered site, to support scattered sites.
However, I think with the CAT situation, was it not, I guess, discussed that there needed to be an RFP process to utilize those funds?
That I cannot speak on, but I'm happy to have Don speak on that.
We did complete the competitive RFP for the Housing Navigation Center, and that's where these funds are being amended to go. So that was a competitive RFP process.
Okay, for the Navigation Center?
Yeah.
Okay, that's great. And then for, my other question is for the counseling services, you know, there's been a lot of talk about what the outcome has been at TRAC, and not, you know, a lot of folks who have moved out of homelessness from what has been communicated to us. And so I'm just trying to understand, using the same organization and their wraparound services now at the Navigation Center, I mean, do we think we're going to get a different result this time? Why do we think that? What's changed?
Sure. So, you know, I cannot speak to the previous administration or the previous oversight that was done in terms of the overall data quality and meeting specific measurements. What I can tell you is that the current contract is written, is very clear about what those performance measures are to be, and that will be reported out just like any other provider. Pursuant to our 5-year plan. So, you know, they will be looped in or under that, the quarterly APRs that we will also be reporting to council and to the Continuum of Care Board on. So.
Okay. And then just last question.
Sure.
So it looks like the total amount, at least so far, is around $6 million. And that gets us about 10 months, it sounds like. And so I'm just trying to understand, I mean, what are we looking at for the cost per person? Through that. And I understand some of this is passed through. It's not all local money, understanding, but just with the total cost, because, you know, the original proposal for TRAC was around $4.5 million, and it ballooned, obviously. But I'm just trying to understand how many we're serving with these dollars.
Well, I mean, two things. One, you know, with the ARPA funds, we do have a longer roadmap here. We don't have to expend those in any particular time frame. So I think we are certainly working with Zeke to make sure those funds are utilized beyond the next 12 months. The other thing is that, you know, this is a new system, so we don't know how many people we're going to serve per se. I think what we do know is that the data points Ariel reference in terms of the performance metrics in the contract are going to actually give us that information, which the prior contract with TRAC did not. And this is facilitating far more locations than the TRAC shelter as a standalone shelter. And then also using money on more intensive services instead of things like porta potties and shower trailers, which are not creating an outcome, whereas a case manager or a substance use counselor would create an outcome. So it's a better use of the funds, and certainly in a more structured format so that we can provide those answers for you.
Right. But we are putting the money in this contract, and this contract expires, middle of next year? So, I mean, the dollars aren't being reserved for beyond that. They're going to be spent in these 9 months, 10 months.
They can be, but we can also amend and extend contracts as needed if we're seeing the outcomes we want.
Yeah. And then can we also get a breakdown of the various costs? You know, we have a breakdown for operations and all the, you know, the line items for TRAC and other things. Can we get that for the Navigation Center as well?
Like an invoice review?
Well, not an invoice, but just a categorical breakdown of how the dollars
yeah.
are supposed to be spent.
Yeah.
That'd be great.
Great. Council President.
I just want to ask on the opioids, so if Revive gets this contract, they'll be doing the outreach for substance abuse. I guess my question is outreach to what end? To a referral for services or housing? I guess I'm challenged just by the wording of that.
Yeah. So first of all, the Revive would be working closely with our HOT team, homeless outreach team, which right now is just code enforcement and Spokane Police Department. And so they would be coordinating with them so that we actually do have an outreach component with that work. And they would be contacting folks first to do a needs assessment and identify individuals who either have OUD or struggling with exposure to or at risk of developing OUD, and then identifying what resources are possibly available for them and working on navigating them to those resources, and then also, if someone is somewhat treatment resistant, to do the work of developing those relationships so that when they're ready, they can be navigated swiftly into available services. So it would include treatment and housing, and then any other needs that are identified by Revive.
We'll look forward to some data point on that. Thank you.
Absolutely.
Appreciate it. Any other questions?
Yeah, I have a question. Sorry, I don't see it on the contract amendment. I don't see it on the agendas in the next 2 weeks. Is it coming up sometime after that?
What are we speaking to? I think we're on
Oh,
the,
there it is, number 4 in the consent right there. Okay.
I think we're tonight at the 3:30. Is that what you're referring to? Is where does this come up again? Yeah. So my understanding is that it'll come at briefing.
For tonight's discussion on that, I would love to have either somebody from purchasing or legal come, because I'm a little fuzzy on how we can just take $1.8 million and add it onto a contract, even though it was for housing navigation purposes. I feel like there might be a discrepancy between.
No, the RFP that Empire Health Foundation was a successful winner of was for housing navigation and scattered site shelters.
And so we just added another 1.8 million on top of that?
Yes, because the SBO said I can only use it for relocation or scattered site shelter, and this is the scattered site shelter provider for the community. So it's an amendment to that contract, which is why we're coming before council.
Right.
But we've met the procurement guidelines through the competitive RFP. I'm happy to see if Jason's available, but we worked with legal and Jason on this.
Okay. Yeah, I would love to be able to ask a couple questions on that, so thank you.
All right.
Is there anything else I can help with
No.
or answer? Okay.
Thank you so much.
All right. We'll see you soon.
Yeah. All right. Next up, actually, we'll have Chief Oberg come back for wildlife mobilization reimbursement. Thanks so much for waiting. Should have had you come up and do this before after your
That's
update,
all
so
right.
appreciate that.
That's all right. Get my steps in. Let me get to the right one. So this is for special budget ordinance for our MOBs. So Spokane Fire Department, we had more than 12 individual mobilizations in this wildland season. So to date, we're sitting at about $613,000 that is reimbursed primarily through DNR, although there are some other reimbursement avenues for that. We are not completely done, even though the weather outside looks like season is done. So by the end of the year, we expect that number, the expenses to be around $700,000. So the SBO is to have that transfer so that we are able to receive those reimbursements.
Chief, I should remember this. So when we get those monies reimbursed from DNR, and does that go back into the general fund? Where do those funds go?
And I'll have Matt Boston, if I start to say anything wrong, jump up and scream. But so the bulk of those come back to reimburse our funds, so our direct pay. There, depending on what we mobilize, there are some revenue streams, very small on those. And I'll honestly have to have Matt confer that those, I believe, still go into the general fund, but then we can have discussions on how those fall into the fire department's budget. But by and large, the bulk of these are labor cost reimbursements for our personnel.
Thank you.
Thank you. Any other questions for Chief Oberg? All right. Speaking of Mr. Boston, you are up now. We'll take these together for year-end police funding, year-end fire funding. Thanks for being here.
Hi, Council. Good afternoon. So I have two SBOs for you. As you know, we are constantly looking at the budget, and part of our fourth quarter review is projecting out where we're going to end at for the end of the year. We've had multiple discussions over the year to talk about how lean we are with the budget, right? We don't have a lot of fluff there. There's not a lot of wiggle room. During the mid-year budget review, we actually swept about $500,000 back, originally intending for the general fund reserves, but moved it to the traffic calming fund by council action. That said, with a very tight budget that doesn't have a lot of wiggle room, we have to keep an eye on things as things move. There are two actions here, one for police, one for fire, as Chief O'Berg talked a little bit ago. The first 7 months of the year was trending actually pretty healthy for fire overtime budget, but months 8, 9, 10, and 11 have seen unusually high spikes from prior years, and therefore we're having to do an SBO to cover that overtime cost for the remainder of the year. The overtime cost that we are pulling from that budget is out of their capital budget. During discussions, we had long deliberations of, do we want to pull it from a capital budget or do we want to pull it out of unallocated reserves as done historically, or ARPA, but that's kind of a moot point at this point. The $750,000 in talking to Chief O'Berg and Chief Stockdale is that we can delay some costs that are being incurred in the capital budget for fire to 25-26. As you've all probably seen in the 25-26 biennium, fire's capital budget increases substantially from previous years, so they have the ability to delay some of those costs for the 25-26. That is the $750,000 that is going to support them for their overtime costs for the rest of 2024. Police is a little bit of a different story. Again, this is something that we didn't know that was going to happen during the mid-year budget review. During the mid-year budget review, we hadn't had the SSP finalized on how many we were going to get. We didn't have the transfer from the Public Safety Personnel Fund, identifying that structural gap in the long-term biennium, so pulling the personnel costs out of 1625, which is that Public Safety Personnel Fund. And then we also didn't have the MOU with the Guild that was settled on late September that allowed for substantially more comp time payout from years past. So all of those things compounding together, in addition to the vacation and sick time payouts from the Guild and the lieutenants and captains SSP, identified that we didn't have the funding for 2024 for the remainder of the year. Obviously, we don't know all of these things going into it. The one thing that I wish that we would have had a little bit more discussion on was the comp time conversation. It was my understanding that the Guild brought this specific circumstance under previous Lundgren's oversight to say, hey, this is something that they're looking at filing a grievance for. Anyways, long story short, it came to my desk probably late summer or early fall, which is that September when we signed that MOU, which was a pretty substantial hit in the tune of about $800,000. So that all said, we're pulling $100,000 out of the ARPA allocation. The reason that we did the $100,000 from the ARPA allocation was there was a multicultural center award that cannot be fulfilled. They withdrew their application, so that $100,000, knowing that we have to contract that by 12/31/2024, we just decided to put that in there. Obviously, completely up to council's discretion on how they want to do that. And then the million coming from unallocated reserves. Questions? Yes.
Yeah, so I'm still trying to understand how the reserve balance at the end of the biennial budget is going to be what the budget says it's going to be, which is pretty substantially high. Maybe you could explain that a little bit in the context of this. We're spending $1 million out of it. We're going to be down to about $6 million in there. I'm not really sure how we're going to increase those funds, but the budget says that we are.
Yeah, the budget, has it has a surplus baked into it. We're using some of the, and we've talked a little bit about this, but we're enhancing it through a couple of different very, very instrumental levers that we got partnership with the fire pension, using the fire pension for some of the the capital cost for fire in 25, 26, which was a huge help. That was $2 million per year. And then we also had excess funding in the DSC fund that allowed us to pull $4 million from the DSC fund, which was just reserves that had been built up over the years. Similar to what happens sometimes in utility funds, the RCW is right that you can make a transfer once in a great while as long as it's justified and that it's not an ongoing effort. We actually have been deliberating kind of that justification and the ins and outs of that fund throughout the year and how exactly to strategically use that. We're again using that for public safety capital in the transfer over. So that gives us the ability to enhance the public safety capital for 24-25 without hurting the general fund unallocated reserve. It doesn't get us quite to the 2% increase that we wanted year over year, but it's pushing us in the needle. Obviously, with all of your help in the reductions that we've taken so far in 2024 that the administration and the council has worked together on, as well as the 2025 budget that has further of those decreases in ongoing costs, leads us to kind of bringing us back to ground zero. Again, this is a longer runway than we originally anticipated. I think you all remember when we originally started having the conversations of both in revenue enhancements and expenditure reductions. We were talking about a public safety levy lid lift that was going to get us $30+ million, that was going to solve our problems, and we weren't going to have to do some of the very painstaking process of the reduction. I think, the 10% reduction, whether it would have been the public safety levy lid lift or the community safety sales tax, I think got us to a spot that identified some real key efficiencies within the city government that we desperately needed to do and we hadn't done for a very long time. So as we're looking at that and we're looking for our long-term partnership with our different union groups and kind of getting back to that level playing field of matching those revenues and expenditures, I think we have built that runway to start bolstering those unallocated reserves bit by bit.
Yeah, one more. And I still have a lot of questions on some of those dollars that are being utilized, like the DSC fund, especially with just some of the other, aspects of how those dollars could be used.
Yep.
My other question is the same as I had asked earlier. How, with the very minimal amount of budgeted for fire overtime in particular in the biennial budget, how are we going to ensure that we are not in this exact situation, although I think it'd be far worse potentially, but in this situation, a year, 2 years from now, with having to pull from reserves essentially to pay for overtime costs?
Yeah, and unfortunately, I don't have a crystal ball to say that that is something that I can completely take off the table in the position that I'm in. I think even when I was working for council, generally when I saw public safety overtime kind of give me that blinking red screen alert very early on, I was telling you all, and I would do the same thing in the position that I'm in right now. I didn't plan, it's not necessarily a pleasurable conversation for me to tell you that, we need a little bit more money based on actuals that are happening in the tail end of the year that are an anomaly from previous years, but it does happen. Things do arise. I mean, I can't say that we can't have a tight budget without saying that there's going to be an opportunity for us to say, hey, we built a very tight budget. We didn't want to give a lot of fluff and wiggle room for departments to just kind of be willy-nilly with their budgets. But in that said, we have to be able to come back to you for corrective action when it's needed. And those are the types of things that we need to do. Just as Chief O'Berg said, I mean, we've done the break-even analysis. I think 40 firefighters in that relief rotation is ideal. We don't have the money to, we don't have the ability and the resources to invest in 40 firefighters as it is right now. So we are maintaining some of the fire overtime. We're also keeping some of the fire overtime and further reviewing the detailed need of the fire overtime that isn't necessarily shift work, but is the kind of ancillary overtime that we're seeing. So it's a continually evolving process that we're always keeping our finger on the pulse to dial in better projections, and that's what we're doing.
Well, and I appreciate that. I mean, I think we should have made some bigger moves at the mid-year review, frankly, to prevent this. And if we'd have made some adjustments earlier on, it would have been less painful, and we could have made up for it. And to that end, same thing right now. I mean, we're setting the budget for the next 2 years. We're being, very conservative with fire overtime when every single year it has gone significantly over. And this year, right now, we're twice what we're planning for the next. So I'm just trying to understand. I mean, it just feels like we're not building in the measures that we need to, which is something you and I have talked about a number of times in previous budgets, where it was a huge mistake and we knew it, and then we ended up having to find millions of dollars at the end. So why not do the millions now when you can make more thoughtful adjustments than pushing this off to 13 months from now or 8 months from now or 24 months from now in terms of making those adjustments then. I mean, we should do it now. It should be as close as possible now to have as minimal of adjustments necessary when we do come up with the quarterly and mid reviews.
Yeah, I see your point on that, and it's what I'm challenged with is kind of the chicken or the egg, because if you look at the last 3 years and you look at the much larger fire overtime budgets that they initially inherited in the adopted budget for those years, you see that while those budgets were substantially larger, the SBOs at the tail end of the year were also substantially larger, right? We had $3 million in, I think, 2022, I think $1.5 million or something like that in 2023. 2024, we've got a smaller budget, but we're looking at $750,000 of an SBO. So we're trending in the same direction. We're trending in the right direction by the amount of the year-end SBO, meaning the correction that we're making, and we're giving them less budget in the onset of that year. So overall, we're spending substantially less. And then when you talk to Chief O'Berg, just like she mentioned a moment ago, that the hours are decreasing substantially. So we're trending in the right direction in all regards, but you have got to be able to tighten the screws at the end of things. So I don't know, that's something that I'm going to continue to work on, right, is better projections and how we can mitigate those problem areas at the tail end of the year, because just like you don't like them, I don't like them. But I think with the trends and the amount of money that we are saving year over year based on this action, I think it's the correct action to take. We're really trying to get to that baseline budget where only overtime that is happening is that immediate, like that absolutely urgent overtime that is completely unforeseen. And I think building this relief pool, while not exactly at 40 where we would ideally love it to be, is going to get us and help educate us even further to say, okay, we're tightening the screws even more, and we've got to either add a little bit more in terms of personnel costs, and that's an investment that council has to make, or we have to increase our overtime costs, and we have to be reviewing that on an ongoing basis. This year, when it came to the mid-year budget review, I'm going to be honest, I wouldn't have done anything differently in terms of increasing their budgeted amount in 2024, because it was that anomaly that happened after the mid-year review in months 8 through 11 that really spiked up just uncategorically, that was so surprising. And so I think when we do that, I don't want to give them so much budget when I'm seeing that they're kind of baseline, they're at their budget, and their budget to actuals pretty well. So I guess, I don't have a perfect solution. I wish I had a crystal ball to tell you exactly what, all of the unforeseen circumstances were going to be, especially in the public safety world. That's the most difficult, right? Because when somebody calls 911, you can't say, hey, sorry, our overtime budget is too high and we can't come respond to you. But like you said, we've got to be better about projecting, and I think we're getting that. We're going in that direction.
Thanks, Matt.
Yep.
Questions? Yeah, go ahead.
Sorry, in the paperwork here, it says that there was a cash out far more compensated balance hours than previously allowed.
Yeah.
And I seem to remember this 1.1 million. Am I wrong on that? What was the difference in the MOU from what we approved?
Yeah, so the MOU, I think it was signed, September 23rd, if I remember correctly, that said something along the lines of, previously it said like comp time, comp hours over 80 hours will be cashed out, so no option to request additional comp time out. Now they can actually, and I know Dave's here, but now they can request additional comp time out on top of the 80 hours that must be cashed out, up to another 80. Is that correct, Dave? The comp time payout MOU, or is it the dates that I'm conflating? It's all kind of a wash.
we can
Yeah,
follow
I'll
up for
follow
more
up with you and
clarification.
get you the exact verbiage of what the financial impact was, but I'll send it over to you.
Great, thank you. Any other questions for Mr. Boston? All right, thank you. All right, now on to council reports. Pull that up.
You want to start with cops?
Yeah, go ahead. Do you want to do two cups?
Yeah, there was a board meeting last week. Unfortunately, I had a conflict and was not able to be there. Candy actually kind of went in my place, which I appreciate. The only thing I will just add, though, and it's already been brought up, we have had a long relationship with cops as an organization. They do provide a significant number of services, stuff that PD has not had the ability, resources, time to provide, such as, low-level burglaries and being able to do fingerprinting and things of that nature. So I think it's going to be a huge loss that this is not funded in the budget. And I think I will be advocating very hard that we do fund it, because I think it's important and I think that there's a lot of value. And so I just think it's a mistake and unfortunate. And I know Jeff is here as well from COPS. And hopefully we'll be connecting with everybody on this council at some point.
Okay, thank you so much. For Police Advisory Committee, we had a meeting early October at the MLK Center. It was just more of a chance for the committee to meet the chief and for community to connect. Policy Advisor, Chris Wright.
Well, I imagine the coming month will mean continuing work with Mr. Byrd and the whole council on rules revisions. And as we get to the end of the month, we'll also have a lot of housing, homelessness ordinances to marry together or consider together and revise together. So I'll be involved in that. And I'll also be working on ordinances relating to the council's involvement and contract approval for CHHS and 1590 funds and all that. So we'll be tackling an ordinance or two in that category as well.
Great. Thank you so much, and thanks for all your work at the retreat. And Jacoby, that was very productive, and appreciate all the efforts that went into that. We'll call this meeting adjourned. Thank you all so much. We'll see you in December.